So let's say my patient would benefit from a brow lift, and a brow lift would address ptosis, which is drooping of the brow, the heaviness in the brow area. A lot of patients recognize that in the mirror as sort of heavy hooding of the eyelids and just looking a little less refreshed, maybe tired in appearance. The way I address that is through an endoscopic brow lift. And what that is, it's a surgical procedure where I make small incisions in the hairline, one in the middle of the hairline here and one above each eye, and then one incision in each temple. All of these are behind the hair and hidden in the hair so that there's no evidence of surgery. The endoscopic brow lift approach allows me to use a small camera that I enter into those incisions and lift the brow all the way down to the upper border of the orbit or the eye socket. I release the tissues across the brow and then elevate the brow upward and outward. Some patients request just what we call a lateral brow lift. Maybe these are younger patients in their later 30s, early 40s, and just need a little bit of a lift of the corner or the tail of the brow. And so that approach mostly focuses on the sides of the brow in just lifting the brow up and out like this. The procedure itself requires use of dissolvable anchoring devices that when I lift the brow, I anchor the brow to those devices, and those dissolve after 4 to 6 months. Little tiny incisions are closed with suture or surgical clips that are removed after about a week, and downtime is somewhere around 10 to 14 days. Mild to moderate bruising and swelling of the upper forehead.